A hearty good afternoon and welcome to our session on fertility assessment. We are glad to have Dr. Sunitha Ilinani among us today to help us explore this topic. Understanding your fertility quotient is essential in the journey of a successful pregnancy. So, assessing it is very important. And what are the ways to assess our fertility and how do we improve on it is what we'll explore in today's session with Dr. Sunitha. So, Doctor, you have the stage.
Yeah, thank you. Thank you so much. Yeah, good afternoon, everyone. Welcome to another Facebook live session. Today is a very important and an interesting topic for couples who are trying to conceive. So many times in the OPD, when patients come to us, lot of times patients are like confused. What are the fertility tests? How those tests are done, and why are they done? And what are the precautions they need to take during the test, and when they should come for the test. So these are the questions usually patients have on their minds when they come for fertility assessment. So let me just run through all these queries. So we know, just to get you an idea, basic idea, if you've been trying for a month, then your chance of conceiving would be around 25 to 30%. And if you've been trying for say 6 months, the chances of you conceiving is about 80%. And if it is more than 6 months, if up to 1 year, if you have been trying to conceive, there's a 90% chance that you will conceive. So that's very good news. So we'll have about around probably around 10% of the patients who are unable to conceive in spite of trying regularly for their pregnancy. So when do you consult a fertility specialist? As I previously mentioned, if you have been trying to conceive for an over in a year, then that is the time we need to consult your fertility specialist. It's There are some exceptions to this rule. One important thing is if you happen to be more than 35 years of age, and if you have say tried for 6 months, then it's better that you consult the doctor after 6 months and not wait for a year. That is because in this age group is a very special age group where the ovarian reserve can come down. So it's important you consult early before you lose out your eggs. The other important thing is if you happen to have irregular menstrual cycles where your cycles are like, say, coming after 45 days or 60 days, or sometimes you're not menstruating for, say, over 3 months, or sometimes if they're coming very early, say around 15 or 20 days, these are the patients who need to consult the doctor immediately rather than wait for a year. And supposing as a couple you have sexual dysfunction where husband is unable to perform, or you are not able to cooperate, or there is lot of pain during intercourse, then it is advisable not to wait for a year. We have seen lot of couples who are waiting for years when they actually have some problem during intercourse itself. It's important that you consult as early as possible so that the doctor can advise you on how to plan your pregnancy. And supposing you have a history of previous surgeries, it could be for your endometriotic cyst or some surgery on the uterus for fibroids, any pelvic surgery if you had undergone, then, or if you have any previous history of sexually transmitted diseases or pelvic inflammatory disease, some infections in the pelvic area, then it's important that you consult your doctor early on, right? So this is when you should consult. Then we know very well that both the male and female are equally responsible for fertility issues. A lot of times there's a misconception that only the female can have fertility issues and the male need not get any test done. That is not the case. Right now we are seeing a lot more uh, male infertility issues coming up. We have seen a lot more patients having low sperm count. So it's important that both of them come for fertility assessment. And usually, in one third of the cases, it's only female factor, and one third of the cases, it's a male factor. And in one third of the patients, there can be a combination. Both the male and female partner can have issues. And the reasons why you are not getting pregnant can be possibly, it could be because of ovulation issues, It could be because of low sperm count. It could be your age factor. If you happen to be more than 35, then your fertility drops down because of the age factor, because of the lower oocyte quality. It could be fallopian tubes blockage. It could be your endometriosis or endometriotic cyst, or it could be underlying medical disorders which could be causing problems in fertility. Now, coming to the fertility assessment, how do we go about this assessment? Now, it's advisable to visit the clinic with a prior appointment. That's very important because the doctor needs to spend some time with you. So, it's important you take a prior appointment and come to the fertility center. Here in Apollo, we insist patients to take an appointment and come and not just walk in, and both partners should be present, and that's very very important, so that the doctor can take detailed history. Then it's also advisable, if possible, to come on the menstrual cycle day 2 or day 3, because so that a lot of the workup can be completed uh, around that time. Now, coming to what exactly the doctor does when the patient comes to the fertility clinic, there will be a detailed history which will be taken, where we will ask you how long you have been married, how long you have been trying to conceive, and whether you had any previous history of miscarriages, whether you have used any contraception for in order to prevent pregnancy prior, or do you have any associated medical issues like diabetes or any immune related medical disorders like SLE or rheumatoid arthritis, or if you have any hypothyroidism or hyperthyroidism, all this medical history will be taken, and of course cardiac problems. All these are important that you should share with your doctor and explain what medication you are on for these issues if you happen to have any medical disorders. Also, any surgeries you had underwent in the past, it's important that you get all the details of the surgeries you had in the past, so that the doctor can look through all these reports and see what exactly the surgeries you had, so that they can plan the treatment very well. And also, details about any previous fertility treatments you had undergone is also very important, especially if you had an IVF cycle. It's important that all those details are shared with the doctor. And also, a doctor will look into your habits also, like smoking, alcohol, your lifestyle, whether you are exercising, whether you're taking proper diet, and what is your stress levels, whether you're in sleep disorders, because all these have an impact on fertility. So these need to be looked into in detail. Coming to the tests that are done for fertility assessment, it's preconception blood investigations are done for both the partners. There are certain hormonal blood tests for the ovarian reserve assessment done for the female partner. Then there are tests for ovulation also will be done during a fertility assessment. Then there will be a transvaginal ultrasound of the pelvis. Then to in order to rule out if there is any fibroids or polyps in the uterus, which needs to be tackled in order to improve your fertility. Then there will be a tubal assessment to check the fallopian tubal patency, as tubal blocks is one of the reasons for infertility issues. Then semen analysis for the male partner is again a very important and a crucial test that needs to be completed. Now, coming to the ovarian reserve testing. Now, what is this ovarian reserve testing? How does the doctor do this? So, on the period cycle, day 2 or day 3, there's a hormone which is measured, which is known as the FSH, or the follicle stimulating hormone. Then there is also what is known as estradiol. Now, both these hormones are done on day 2 or day 3 of the cycle, and your FSH is raised, then that means your fertility is getting lower, that your egg reserve or number of eggs are coming down. And especially if your FSH is more than 12, that's a red flag sign. And if again your estradiol levels, if the estradiol level is very high, say more than 80 picograms, then again we understand that the number of eggs are probably coming down. Then also the doctor will do what is known as AMH, or the anti-Mullerian hormone. This is a blood test again where it can be done on any day of the menstrual cycle. It need not be on the day 2 or day 3 in particular. It can be done on any day of the cycle. And but ensure that you are not on any contraceptive pills when this test is done, because that will impact the result. Now, again, low AMH indicates that you have low ovarian reserve or a low fertility, but it doesn't mean that you cannot get pregnant. Um, so, what are the when you have What are the symptoms that tell us that your ovarian reserve is low? Is your irregular periods, or you may have miscarriages, or you may have difficulty in conception, or your periods may completely stop. These are some of the symptoms which we see whenever the woman's ovarian reserve is very low or where there is low AMH. The one other test that is done by the fertility specialist is the antral follicular count. This is a very important test which is done as a transvaginal ultrasound examination, which is done on the day 2, day 3. Mind you, it's on day 2 or day 3 of your menstrual cycle, where the doctor will check how many follicles are seen in the ovary on ultrasound, and at least more than 5 is a good number to have in each of the ovaries to understand that you have a good ovarian reserve. Anything less than 5 antral follicular count, and especially if it is less than 3 antral follicular count in each of the ovaries, that tells us that the ovarian reserve is very low. So this is a very important test that needs to be done, the ovarian reserve assessment, in order to understand what are the treatment options that needs to be given to the patient, and how to go about treating the patient. Uh, some of the reasons for the ovarian reserve which can come down is if you have endometriosis. Patients with endometriosis, because of the endometriotic cyst, can have lower ovarian reserve, and it could be some genetic factors, especially fragile. Those who have a fragile X mutation, they are the ones who can have again a low ovarian reserve. And if you had previous cancer treatment, either chemotherapy or radiotherapy, it can affect your ovarian reserve. And of course, not the least, your lifestyle, eating junk food, processed food, can impact your ovarian reserve, especially there are the chemicals can disrupt the whole endocrine system and can affect the fertility. Coming to how is the ovulation tested, a very important thing where a lot of patients are curious to know how can we test our own ovulation. So one of the things that can be used to test your ovulation is the LH kit. And this urine LH kit is something which can be used by the patient themselves at home. Uh, it comes similar to the pregnancy test. This also is a 2 or 3 drops of the urine is placed in the uh, for the test, and then if you see 2 lines, it means that you are going to ovulate in the next 24 hours. And if you see only 1 line, that means you probably may not be ovulating. But mind you, this urine LH test is can be very unpredictable. It can give lots of false negative and false positive results. So it's important that you use a good kit to understand your ovulation time exactly. The other test that is used for to understand whether the woman is ovulating or not is the follicular monitoring, which is done by the doctors, where usually this follicular tracking is started from the day 10 or day 11 of the menstrual cycle, where the doctor will measure the follicle size, and the good size of a mature follicle, of a mature egg, would be around 18 to 20 millimeters. And once this size is reached, that's when the woman is most fertile. And again, test is done 2 days later after the follicle is after the mature follicle is seen, that is about 18 to 20 millimeters. 2 days later, we also examine to see whether the lady has ovulated or not. So that's how we can document whether there's any problem in ovulation or not. And women who do not ovulate, or who have anovulatory cycles, or who have irregular cycles, these patients may not develop the mature follicles. And even if you keep tracking for say 20 or 30 days after the beginning of the menstrual cycle, still you may not be able to see a mature follicle on ultrasound, which tells us that there is a problem in ovulation. So that's how the doctor will understand. Now, the other test that can be done by the patient themselves is the basal body temperature rise. Now, mind you, this is not your regular thermometer that is used to test the temperature. There is a special thermometer to check the basal body temperature. And around the time of ovulation, the woman will have a slight increase in the temperature by 1 degree. And this can be tested by a special thermometer, which will let us know, okay, that is your most fertile period. And also, if you do not have the option of you doing a LH test or a basal body temperature rise, you can always notice a change in the cervical mucus. Around the time of ovulation, the cervical mucus becomes very watery and thinner. Then you understand that this is your most fertile period. So, some of the common causes for ovulatory dysfunction are your PCOS. We see a lot of patients these days having the polycystic ovarian syndrome where they have irregular cycles, and this is one main reason for ovulatory dysfunction. And if you have too low body weight, if you're less than 40 kilos or BMI is less than 19, then you can have ovulatory dysfunction. Or if you're an athlete or you have extreme exercises which you're doing, that can also affect your ovulation. And high levels of stress can also affect. And if you have hormonal issues like your thyroid or prolactin disorders, then they can also affect your ovulation. Then, of course, if you're having low ovarian reserve or you're nearing menopause, then also you can have ovulatory dysfunction. Now, coming to the another very important test that is done by the doctor is your tubal patency assessment, or the to rule out any tubal blocks. Or this is usually done around the cycle day 6 or day 10 of the menstrual cycle. And prior to this, antibiotics are given to the patient. And this is done by two methods. One is your X-ray method, which is known as the hysterosalpingogram or the HSG. The other is this saline sonography or ultrasound guided, which is usually done at our center, Apollo Fertility, where we as it's done. It's a daycare procedure where patient comes to the center, and we give a small dose of painkiller prior to the procedure. And patient is taken into the ultrasound room, and with the help of a small catheter, saline is injected into the uterine cavity. And then this saline which is injected into the uterine cavity should come out of the fallopian tube and spill into your peritoneal cavity or abdominal cavity, and this can be documented by an ultrasound examination. So this is one very simple test and not very painful as compared to your HSG. This is a much simpler test and a very painless procedure compared to your HSG. And of course, if there is any doubt in your HSG or a saline sono, if the doctor feels that there is a tubal block, then the doctor may suggest laparoscopic assessment to rule out the tubal block. And the tubal block can also be removed laparoscopically by treatment known as the proximal tubal cannulation, where the block can be removed and patient can conceive naturally after laparoscopy and hysteroscopy and the proximal tubal cannulation. But again, do remember that this is not a suitable procedure for all the patients. Now, coming to the causes for tubal block, there can be many causes for tubal block. It could be endometriosis, it could be infections, or it could be any previous surgeries you had undergone. It could be pelvic inflammatory, sexually transmitted diseases, or it could be just that your tube may by birth itself may not be very good, or there can be by birth it may be absent, or it may be blocked. That can also be there. Coming to other important test is the male partner semen analysis. Very, very important that after the female partner is completely evaluated, it's also important that simultaneously the male partner is evaluated in order to so that the doctor can give you the correct treatment. Now, the semen analysis is usually we tell the patient to have 3 to 5 days abstinence when they give this semen analysis, and also the doctor may advise some prior blood tests to rule out any infections before the semen analysis is done. Now, in the semen analysis, we usually get a report of the volume, the concentration of the sperm, the motility of the sperm, and the morphology of the sperm. Morphology is the shape of the sperm. The head, tail, and neck are seen very closely and evaluated. Now, all these parameters needs to be in the normal range in order that the couple have a pregnancy. Now, there can be many causes for the low sperm count. It could be hormonal issues, it could be your lifestyle issues, it could be smoking, alcohol, it could be environmental factors, where if you are having a job which involves if you're a job where a lot of heat is generated, say if you're in a factory, or if you're having a job where you're traveling continuously, all these can have an impact on the sperm count. And of course, your sleep pattern, poor diet, all these can affect your sperm count. Coming to the once the fertility assessment is done, where your doctor has checked your hormones, your thyroid, prolactin, FSH, LH, your E2, your AMH, all the hormonal assessment will be done, followed by a detailed ultrasound examination where the doctor will understand if you have any fibroids or polyps, which is probably affecting your fertility. Then this will be followed by a tubal assessment. By usually at our center we do a saline sonography, which is done on the day 6 or day 10, to understand if the fallopian tubes are blocked or open. And once all this assessment is done and the semen analysis is checked, then the doctor will be able to advise you what are the treatment options that are there for you. So the treatment options will of course depend on your diagnosis. Uh, so in case you happen to have ovulatory dysfunction, then the doctor may prescribe you ovulation induction medication, followed by timed intercourse. It's a very simple treatment where the doctor will give you tablets so that you ovulate, and usually these tablets are given on the day 2 or day 3 of your cycle. And this will be followed by follicular tracking to understand whether your follicle is growing in size. And once it is mature, the doctor may suggest you a trigger injection, which is known as a HCG, and following which the couple are advised to have intercourse. This is a very simple and basic treatment, and this can be tried for 3 to 4 cycles, and this will have a very good chances of conception, especially if you're a case of PCOS or ovulatory dysfunction. The other treatment that is suggested by doctors is intrauterine insemination. Now, this treatment is suggested for couples who have sexual dysfunction is there, or in case the semen parameters or mild to moderate low count is there. Of course, it is not a treatment where there is very low count, that is severe oligoasthenoteratospermia. But if it is a mild to moderate low sperm count and motility, intrauterine insemination will be suggested by the doctor. Again, this is a very good treatment for these patients, and it can be tried up to a maximum of 3 to 4 cycles. And then also IVF ICSI is the other treatment which is suggested as a first line treatment in case you have bilateral tubal block on laparoscopy, which cannot be repaired, or if the sperm count is very low, say less than 5 million, and with very low motility, then IVF ICSI treatment is suggested as the first treatment. And of course, if you have failed intrauterine insemination cycles, then again IVF ICSI is suggested for the couple. So that's about the fertility assessment and the fertility treatments in gist. If you happen to have any queries, do approach us in person, or you can always mail us on our email ID so that we can clear your queries. So thank you so much for a patient hearing, and look forward to another Facebook Live in a short while. Thank you.